Hello there, welcome to a brand new OET writing lesson all about how to write a letter of transfer. Shan got in touch, one of my YouTube viewers, hi Shan, and asked for some practice with the following situation. If the patient falls or acquires pneumonia during hospitalisation, what should we include in our OET letter? And this is a great kind of scenario for a letter of transfer. So we're going to practice this in 3 stages. Now, a letter of transfer is not so common in the OET writing, but I have heard that it's come up at least a couple of times recently. Normally, of course, we get letters of discharge or letters of referral, but you should know about transfer letters as well. So that's what we're going to do today. My name's Sona, I'm your online OET tutor with Bose Learning, and I'm a premium preparation provider of the OET. So thanks for joining me today. Okay then, so what's the first thing we have to think about when we get a letter of transfer? I guess what is a letter of transfer really? So let's try and understand that first of all. So a letter of transfer is used when a patient is currently in your care. They're undergoing treatment or therapy under your supervision, so you're in charge of this patient currently. However, they're going to continue this care, exactly the same level of care, with another provider. This might be because they are transferring to a new city or just a different department. So we can think of it this way. If you're writing a letter of discharge, you've finished caring for the patient and the patient is going back somewhere, back into their family maybe, or back into their primary care provider's supervision. If you're writing a letter of referral, care needs to begin, so you're referring your patient for further care with somebody new. However, a letter of transfer just continues the same care with a different provider. So there's your patient receiving care with you, and they're going to receive the same care with somebody else. So here's a little summary for you again, and it's a great way to help you think about what you need to include in your letter. And really, preparation is key with the OET. So prepare before you start writing. Of course, you get your 5 minutes preparation time to read, but even after that, think about what you need to include in your letter of transfer. And that's the key to success, knowing how to prepare and what to select from the case notes. So when you're thinking about what to write, what to include, think about things like this. Does the reader know the patient? Now, if your patient is transferring to a new care provider, the clue is in the new bit, they won't know the patient. So you're going to have to introduce the patient to them, what's happened and what care has been provided so far. Does the reader know what's happened to the patient? Again, no, so they don't know if this is an acute problem, an emergency, a chronic problem, etc. You're going to have to explain that to the reader. And the reader needs to know what they have to do. How are they going to continue caring for the patient? So look for all of these things when you're reading the case notes. Finally, think about what's most important. What do they need to do first? What's also important? What other information do they know? Do they need to know? And finally, what's completely irrelevant? What do they not need to know at all? And that you just don't include in your letter. So again, here's a nice little summary to help you prepare to write your letter. Then stage 3, of course, is to practice, and that's what we're going to do now. So I'm going to give you a set of case notes, and if you want to practice in real time, I'm going to give you 5 minutes to read the case notes like you would in the test. Don't make notes, but just read in this time, and then what we're going to do is make notes together afterwards. If you don't want to spend the whole 5 minutes reading, I do recommend you do this, but you can just skip forward because I have time-stamped it for you. But here we go, here's your 5 minutes preparation time coming, and your case notes are coming up next. Okay, how did you do? So after the 5 minutes, of course, we then look at selecting information that we think is necessary. And that's what we're going to take a look at now. So, first of all, of course, we need to establish who the patient is, Mrs. Emily Johnson, who's 72. We look at the presenting complaint, which was a urine infection. However, we then need to really focus on the transfer plan. And what we're doing is writing a letter to the ward nurse in the Orthopaedics Department outlining the patient's history. So you think, oh, okay, she came in for a UTI and she's going to orthopaedics. Why is that? So then we go back and we check. And it's because she fell on the way to the toilet. There's an investigation instigated, and x rays have revealed an undisplaced fracture. Okay, so we then think, okay, so the main concern isn't the UTI, or is it? So we just check, and actually, it's been resolved. So we don't need to focus on the examination findings and the treatment, a little bit on the treatment, of course, but not too greatly. We need to focus on why she came in, what happened when she was in hospital, and then the main thing is going to be the transfer plan. So, in order to look at the transfer plan and all the medication, we just connect these two up. So, most important information is the transfer plan, but because this is a new patient for the reader, we do need to explain what happened. We need to summarize basically. We don't need to go into the findings of the UTI because that's been resolved. Okay, so let's take a look at an example letter. I'm going to give you 60 seconds just to read it quickly to yourselves. Okay, so why is this a good letter? Let's take a look. I haven't included the information on top, but don't forget to do that. But we have explained the purpose of the letter. So thank you for accepting an internal transfer of our patient. We've given her name, her age, into your care for the evaluation and management of her fracture. Importantly, this occurred during hospitalisation. We then give a brief history of events, why she was admitted, how we treated her, and the resolution. But again, we talk about the fall. We talk about relevant history connected to the fall, so the osteoporosis and the previous fracture, because of course that's what the new reader is going to be focusing on. We also need to talk about the investigation because, of course, protocol dictates that if something happens during hospitalisation, then there's a protocol to follow in terms of why this patient fell. So we need to say that this has been started, but also she might benefit from falls education. That's in the discharge plan, if it's appropriate. We don't want to aggravate any kind of situations here. Then we go on to the discharge plan, what the reader needs to do. So she's started her antibiotic course, she needs to finish that. They also need to keep an eye on the UTI recovery, her other medication, etc., and the pain relief here. We then finish professionally. So this letter, of course, is 200 words. As I say, I haven't included the recipient's name and address. You need to do that in your own letter. I just didn't have space here. But you can see how we have picked out information that's necessary for the transfer. New patient, we're explaining what happened. We're focusing on the situation in hand, which is this fall, previous history connected to the fall, and follow-up care. So I hope that helps you if you get a transfer letter. If, like Shan, you have questions, do ask, because I've got a list coming. I'm creating a list of your questions and I'm hoping to answer as many of them as I can. If you want more detailed information about how to tackle the writing test or the reading test and the speaking test, then take a look at my pre-recorded courses. They're on demand, so you can follow them in your own time. I'll put in some discount codes for you below. And if you like this, I'd be so happy if you can help me grow my channel and send this to friends or colleagues, give it a like. And as I say, just say hi or ask me a question. It's always lovely to hear from you. So thank you for that. And hopefully see you again really, really soon. Take care. Bye bye.